one of the most important discoveries when it came to challenging the Hippocratic ethic was the discovery that the old Hippocratic Oath doesn't have any doctrine of informed consent. There's no requirement of informed consent in old-fashioned Hippocratic ethics. Now, about 1970 or so, we discovered this glaring deficit. And those who believed in respect for human persons came to the conclusion that for lots of reasons we had to show respect by getting the consent of the patient. Informed consent was a doctrine that emerged as an alternative to Hippocratic ethics, as a way of showing respect for the individual patient and the choices for life plans that the individual wants to make. That means it applies only to patients who are substantially autonomous agents, adults, older adolescents who can incorporate their own system of values into the medical choices that are made. This is particularly important in a complex, pluralistic society because we've discovered that the health professional, the doctor, the nurse, the pharmacist, is in a position where they literally can't know what's best for the patient without asking the patient. In a simpler time where everybody shared more or less the same values, the doctor could pretty well guess what was best for the patient. But as we emerge with much more complex cultures and subcultures, doctors and nurses and others literally can't know what's best for the patient without some sharing of the patient's values. So for all of these reasons, we move to a doctrine of informed consent and respect for the patient's autonomy. Now, one of the side effects of that commitment to autonomy is that once in a while a health professional will encounter a patient who makes a choice that looks bad. Technically, the doctor may not really know if it's bad or not without understanding the entire range of the patient's values. But think of a critical life choice around a critical illness like cancer. How can a doctor know whether a full court press with the latest in chemotherapy and radiation and surgery is best for the patient? Or alternatively, a more gentle, more cautious approach that it might involve some of the ideas of hospice may be best for the patient. That's going to depend in part on where the patient is in life, whether the patient's projects for life have been finished, whether that patient is worrying about a child who needs some attention for a while, or whether the patient feels that they're comfortable with their preparation and their dying. This is obviously related to one's religious worldview. And doctors and other health professionals are not in a good position to know what's best for the patient. So for all of these reasons, the doctrine of informed consent has emerged, which gives the patient a responsibility for participating actively in deciding what is good terminal care.